South Korea begins its nationwide inoculation program. Nursing hospitals and care facilities started getting their first doses of AstraZeneca's COVID-19 vaccines. Kim Do-yeon has our top story.
Light at the end of the tunnel. AstraZeneca's COVID-19 vaccines were rolled out in South Korea for the first time on Friday. First in line were residents and workers at nursing hospitals and rehabilitation centers. At one hospital just south of Seoul, around 600 shots were administered on the first day.
I think the authorities did a good job preparing, like they've done with flu vaccines in the past. The jabs are already happening overseas, so I was quite calm.
There was nothing unusual after the jab, so it was okay. Actually, I was a little excited because I thought I could kind of see the end of COVID-19, but I suppose we'll have to be careful until then.
7 containers of AstraZeneca doses arrived a bit past 9 a.m., a few hours later than expected, but there were no problems in getting started. Doctors, nurses, and of course the needles were all in place, and the recipients lined up with their screening questionnaires already filled out. There was a long line outside, but once inside it was simple. First, the screening questionnaire and registration. Then, a temperature check and doctor verification. After that, it's straight to the vaccination. After receiving their doses, the recipients sit down here for around 15 minutes before leaving. This is to make sure that if anyone does have an allergic reaction, they can get immediate medical attention. Fortunately, no adverse reactions were reported, but how will the process work for a much larger population?
In fact, I didn't think that we could do this so organically, in terms of hospitals communicating with the health centers or the process of delivery. This is the first time I've experienced this, and based on this, I think we could keep going forward without too much trouble.
From Saturday, medical workers directly fighting COVID-19 will receive their Pfizer shots. Until July, shots are primarily for those on the priority list, and if all goes according to plan, herd immunity can be achieved by November. As of 6 p.m. on Friday, 16,813 of the ones up for the first batch received their shots. That's almost 6% of everyone who signed up for the dose. Kim Do-yeon, Arirang News.